Well, hello, welcome to Bits on a Wire, and we talk today about alternative therapies in ocular disease. Your coach for the day is me, Dr. Scot Morris. I serve as the medical director for Eye Consultants of Colorado. I'm also the operating partner for Morris Education and Consulting Associates. That allows me to spend every Thursday and Friday, for the most part, on the road teaching, coaching, writing, kind of talking with other doctors about some of our alternative therapies. I am also the co-founder of 4ECPs. We'll talk a little more about that here in just a second. I'm also the chief optometric editor for Optometric Management. So I guess the big part of this is I spend Monday, Tuesday, Wednesday in clinic really trying some of these alternative therapies. I live up in the mountains in Colorado, so sometimes we have a little more access to some of those alternative therapies than other people. But we're going to spend some time talking a little bit about those things today. Since we're doing this for continuing education, there's my financial disclosure slide. Going to probably talk about a couple products specifically. One of them happens to be the Training for ECPs website, where we have e-guides, video resources, and all kinds of certifications that are available for people who are interested in improving their business side of their practice. The other thing I want to do is a little self-promotion. I have a book coming out on Amazon here shortly. iTunes will be a little later, called It's About Time. It is a book about healthcare reform. It's really a story, as the subtitle says, a story about politics, power, money, death, and deception, and really how the American healthcare system and its failures are affecting or impacting all of us, and really kind of thinking about what's going on and how we might fix that. So please pay attention, look for that, and it's a good read. So let's talk about some of the rules of this presentation. Well, first of all, we want to make sure that you have a really open mind about this. There are many alternatives to conventional Western medicine. Now, most of us listening to this have probably been trained in Western medicine. But you have to remember, Eastern medicine's been around for about 3,000 years longer, and maybe even longer than that. And really what we're going to talk about today is kind of a combined approach about how you meld together, if you will, Eastern and Western medicine to really do what we're supposed to do, which is take care of the patient. Try to reduce their issues, troubles, problems, and symptoms. Now, the reality is that a lot of the stuff we're going to today, if you're one of those folks who say, I need to have hardcore science, well, the reality is for a lot of these alternative therapies, there is no hardcore science, because until we get big data that can crunch N in the millions of people, we're really stuck with having some company or some entity financially support some study that shows if these things actually work or not. And if there's no money in it for the company, that usually doesn't happen. And that's one of the challenges with Eastern medicine philosophy. Now, on the other side, you got to remember that most Western medicine, when it's studied, we kind of already have a pretty good idea what the outcomes are going to be well before the study starts. Otherwise, they wouldn't run the study. Second big piece of this is that just because an alternative therapy or even a conventional Western medicine therapy works for one person doesn't necessarily mean that it's going to work for all people. And I want you to keep that in mind as we go through and talk about these things, is we have to each tailor individual treatment plans to the specific person sitting in front of us. That's no different whether you're talking Eastern, Western, whatever. There is no cookie cutter approach, because every biological person, biological specimen or patient we see is slightly different. During the course of this talk, we are going to spend time talking about really the 5 to 6 different forms of treatment options, whether we're talking about environmental management or mechanical management. Of course, then there's pharmaceutical or nutritional type of management. And then we'll talk about some of the other alternative therapies that, whether sometimes surgical, sometimes not, that you may not have even thought of. So we're going to start on our first one talking a little bit about cosmetics, and specifically lash enhancement. I know it sounds like, well, that's really not an eye care thing. Well, actually, it is. And when we talk about lash enhancement, this is a multi-million-dollar business in the U.S. alone, is making eyelashes longer, lusher, and fuller. So let's talk about really 4 of the primary ways that we can help with lash enhancement. First of all is we got to manage the environment. You got to remember, so if we look at where the lashes live, if you will, on the eyelid margin, we have to remember that probably the most important part of lash enhancement is treating any lid margin disease, and specifically meibomian gland disease, because inflammation at the meibomian glands can also affect the lid margin, and more specifically into the hair follicle. So we need to treat what's appropriately for meibomian gland dysfunction. We're going to talk a lot more about meibomian gland function here in a few slides when we get to kind of lid margin disease, but I want you to keep that in mind. Number 2, we talk about mechanical changes, and the reality is that We see lots and lots of people that are doing extensions, and we have to remember the way extensions work is they are glued on to the base of the current eyelashes. And if we think about the fact that eyelashes basically fall out every 6 to 8 weeks and we get a new set, this is why this is a great business, this is a great consumer business, because talk about repeat business in that every 6 to 8 weeks we got to get new lashes put on, new artificial lashes. Now the challenge with that is many of the glues and adhesives that are used are really relatively toxic to the eyelid margin. And so if you have patients who have eyelash extensions, you might want to have a little talk with them about what really the damage is doing, and are there alternatives, and other mechanical, I always kind of laugh, called lift and separate. The way to make any lash look more full is, if they're all bound together with mascara, is to separate them. And obviously this is $1 million business by many of the cosmetic companies to make brushes that can lift and separate the different eyelashes. Now we get to traditional pharmaceutical type of entities, and of course what we always think of is the prostaglandins. And anybody who's treated glaucoma patients for very long know that you put somebody on a prostaglandin type of glaucoma medication, and within a few months they get big, long, luscious eyelashes, whether they want them or not. And so prostaglandins have been around for quite some time. The only ones commercially available now are by Allergan in terms of Latisse. But basically what they're doing is they take that and it changes the way the eyelash growth pattern happens to make them not only longer and thicker, but also in many cases darker. Now, like all medications, when you stop using it, because those eyelashes will fall out, it is a relatively short course therapy, in that it is, I guess you could say, reversible, in that when you stop it, within 6 to 8 weeks, the eyelashes will go back to where they were. Then we get into the nutraceuticals. We think about, eyelashes are hair. They're nothing more than that. So we need to talk about what we do in terms of keratin. Your eyelashes, your eyebrows, your hair follicles, your nails, they're all the same thing. And so you're going to need to change the way you take intake of keratin. And specifically, you can educate your consumers, your patients, about starting to take what's called collagen hydrolase. Most health food stores will have this collagen hydrolase. It is a mix so you can put in your protein smoothie or mix together. And what you'll notice, it makes your hair thicker, your skin softer, your hair follicles longer, your nails stronger, all those different types of things, as well as there's some theory that it may help improve all collagen tissue throughout your body. We also have to remember that there's a hormonal influence that goes with eyelashes. Eyelashes, just like most keratin, are influenced largely by estrogen. And so in many patients, if they've noticed that they're starting to have hair changes, you should probably have a hormone panel done to look at what their estrogen, progesterone, and testosterone levels are like. Probably also wouldn't be a bad idea while you're in the process of looking at what their thyroid patterns are like in terms of TSH, T3, T4 levels. We know there is specifically a very good hormonal influence, and it deals with all those hormones we talked about. Also, is like any type of hair follicle you're talking about on your scalp, your eyebrows, your eyelashes, or skin in general, is we need to make sure that we have the appropriate amount of oil. Many patients who are on a very low-fat diet will notice that their hair gets brittle, their skin gets dry, all sorts of things. We need certain good oils and lipids, and we're going to talk a lot about oils and lipids in the upcoming slides, but we definitely need to concentrate on making sure that diet is a large part of our discussion. Is, are we taking the appropriate omega-3s? Are we taking the appropriate fat intake for our body? And that obviously is different for every single person, but you need to read up a little bit on what is a fat content supposed to be like. And most people say, you need to be getting approximately 30% of your total caloric intake during the course of a day from good fats, oils, and lipids. Now we get into kind of some more cosmetic stuff or periorbital edema, or what many patients affectionately call the bags. Well, when we talk about this, there's 5 major components. Number 1 is the environmental component, meaning that there is no substitute for sleep. Number 1, sleep is important. It's what helps your body clear out fluid. Your eyelids, where the skin is very, very thin and there's a huge lymphatic system. If you don't give time for your body to pump the lymph out of the system, you're going to have more congestion, more edema, more swelling. Number two is managing chronic allergies. For much the same effect, is that these chronic allergies cause localized or regional edema due to changes in the lymph system and the drainage system. Number two, we talk about mechanical. Now, the bags, the reality is, since we know that in many cases this is inflammatory or in some cases a edematous issue, there is no better substitute than a cold compress. The reason why is cold compresses decrease blood flow to an area. If you have decreased blood flow to the area, you have less intracellular edema and intercellular leakage. There also are there alternatives to this. The alternative medicine, we talk about tea bags, potato starch, cucumber slices, all things that people have talked about and you've probably heard about before, and they all work basically on an osmotic gradient to help pull fluid out of that surrounding tissue. Our favorite here is cold tea bags. Candidly, I think it works better than any drug we're going to talk about, and we've used this and talked about this for years and years and years. The one challenge you need to be careful of with the tea bags is if you get a really light-skinned person, you have to remember that these wet tea bags will leak some of the tannins from the tea and can cause some pigmentation issues. For those people who are really light-skinned, you might want to talk about other alternatives like potato starch, cucumber slices, blah, blah, blah. Other forms of mechanical are sleep masks. Now, many people, especially those people who suffer from something like sleep apnea, where they're constantly having a mechanical effect on the eyelids themselves, a sleep mask that takes the abuse versus their eyelids might be an interesting alternative. From a pharmaceutical standpoint, we talk about topical NSAIDs, steroids, decongestants. The reality is, at least in my experience, is the majority of the topical NSAIDs and steroids don't do a great job of getting rid of the periorbital edema. They might help with conjunctival edema. They don't do a lot in terms of the periorbital skin. On the other hand, oral Benadryl we have seen been helpful in terms of decreasing some of the localized congestion and edema. Of course, one of the challenges with oral Benadryl is many people can't take it because it makes them sleepy, and there's a small subgroup of people that if they take oral Benadryl, it actually makes them kind of wired. So, I always tell people, be a little careful with that. You got to try it out if you haven't done Benadryl before. Please don't do it while you're driving, and please probably a night when you don't have to get up early the next morning in case you're one of those people that have Benadryl wires. I happen to be one of those people. Nutraceuticals. Now, there's no substitute for, actually, and I know it sounds contraindicated, but to increase your water intake. The reason why is most periorbital edema is based on, as we said before, an osmotic gradient. So by increasing your water intake, you're going to flush out more of these solutes due to osmotic changes. You'll flush out more of the solutes that are causing some of this localized edema. In fact, most people say the quickest way to lose weight is actually to increase your water intake. Now, the first day or two, you may have an increase in water levels, but over time, because you're actually diluting out some of these solutes that are causing water retention, you can actually help your overall edema levels or hydration levels. You also want to be careful to decrease salt and other dehydrating drinks. The big ones are Coke, or I shouldn't say Coca-Cola, but any types of sodas, coffee, those types of things, alcohol that are dehydrating, don't necessarily help the system. Last but not least, we get to the surgical issues. There's things like lid lipo. Many times when we see what's called periorbital edema or bags, what it actually is thin skin, where we're seeing the vascular issues, the vascular tissue underneath. And many of these people can actually benefit from having either fillers. Tear trough is one of the biggest ones, the dermal fillers. Hyaluronic acid injected into that area, or as some people actually have what's called lid lipo, where they actually have fat either removed or altered, or even some cases injected into that thin area to help build up a fat layer underneath the skin so the vascular layer underneath is less apparent. Blepharotosis and other eyelid changes, as you call, or sagging maybe. Sleep masks, as we discussed. Topical steroids can have some minimal effect, especially if it's just inflammatory edema causing that of the conjunctiva. We're much bigger fans when it gets to nutraceuticals of vitamin C. Remember, vitamin C helps improve collagen tissue, collagen strength, and for many people, over a period of time, they've lost some of that collagen integrity, and increasing their vitamin C levels have been very helpful. Moisturizers are always important. Now, there have been some other ones that are are kind of work more on that osmotic gradient. Once again, we've heard, in addition to what we talked about before in terms of tea bags and cucumbers and that kind of stuff, one of the biggest ones on the internet is actually plantain cream. Now, plantain, as you guys remember, is more of a potato, but kind of looks like a banana, and really we're working on osmotic gradient. And this is especially helpful for those people who have issues with hyperpigmentation or tannin release from things like tea bags. There's been reports that egg whites have been helpful and coconut oil, and once again, all of those things are working because basically what you're doing is reducing edema. If you have less edema, there's less weight on the eyelids, and there's less of a pull due to gravity to close the eyelids. Coconut oil happens to be one of our favorite things, and we're going to talk a lot about coconut oil as we get into some of the future slides. But that's one of those that's a great moisturizer as well as a great antibiotic. It has all kinds of antibiotic properties, increases the amount of essential oils on the surface. In addition, it acts as an osmotic gradient. Surgical, there's the common ones like Botox and collagen injections, but more commonly when we talk about blepharoptosis, we're talking about blepharoplasty. So if you don't already have a good plastic or cosmetic ocular surgeon that you refer to, you might want to go do a little homework and try to find somebody that's helpful for that. Other alternatives, and this is especially true when we get somebody who has what's called floppy eyelid syndrome, and these are when they get really flaccid or loss of laxity of the upper eyelids in particular, but it can affect lower too. One of the alternatives is actually treat the problem, which is find out floppy eyelid syndrome is usually associated with sleep apnea, so send them to a sleep disorder clinic. If you don't know of a sleep disorder clinic, that's another thing you might want to do and find out and do some homework on. Because I'll tell you, sleep apnea is a very, very common disease once you know what questions to ask and what to look for.